Live from Hallandale Beach, it's Holistic Strides. Hey now, everybody. Welcome to Holistic Strides, a Start With Your Feet production. We are coming to you live on tape from my office in sunny Hallandale Beach, Florida. My name is Dr. Richard J. Rimler, otherwise known as Doc Rick, and I am one of a few holistic podiatrists in the country. I am your host of Holistic Strides, a talk show devoted to taking small but powerful steps down a path to a more holistic lifestyle with an emphasis on foot health and the start with your feet approach to wellness. This includes unique advice on supportive shoes, orthotics, exercise via interval training, vitamins and supplements, stress management, organic nutrition. So, why should you watch or listen to my show? The short answer is to achieve better health through self empowerment with the understanding that it all starts with your feet. The idea is to add one holistic principle regularly to your life and gradually transform yourself to better health. Just take it one step at a time. I can guide you since I have undergone the same transformation. Therefore, I walk the walk. Today, I will be talking about spinal stenosis. Before we get to that, I will go over what I feel is the most important thing that you can do for your health besides not smoking cigarettes: interval training. Start by picking your preferred mode of exercise. It could be walking, running, using an exercise bike, treadmill, doing jumping jacks, or swimming. Try to do this close to home for convenience. Also, try doing it in the morning since it only takes 10 to 12 minutes. That way, you can get it in before work or school. Here is my personal prescription for interval training. Start off with a 20-second fast velocity, followed by a 1-minute slow recovery speed, and do this for 6 intervals. In my case, I go out to the street in front of my house and I sprint for 20 seconds. Then, after the recovery portion of roughly 1 minute of slow walking, I reverse my direction and sprint for 20 seconds once again for the next interval. After doing 6 intervals at 20 seconds fast speed, I then switch to a 15-second fast velocity, followed by the same 1-minute slow recovery speed, and do this for 3 more intervals. Guess what? You are now done with your workout. The take home point is that the final 3 intervals must be done at a faster speed to reap the health benefits, which are substantial. Those benefits include strengthening your lungs and heart, aiding in weight loss by inducing a 12-hour fat afterburn, better oxygenation to your cells, and most notably, being anti-aging. Think of it as your own personal stem cell treatment given to you by yourself. I have been personally doing this technique since I was about 50 when I first heard about it, and I think this is one of the main reasons for my continued good health into my 60s. By the way, you can access a free ebook download about interval training, including my prescription, by going to my website, startwithyourfeet.com, and you will find it in the blog section. I invite everyone to incorporate interval training into your schedule and kickstart your path to wellness. Now let's get to our main topic today, which is spinal stenosis. So, spinal stenosis is probably one of the hardest entities and diagnoses that I come across in order to treat and to get to a good resolution for it. Spinal stenosis, in essence, is a narrowing of the spinal cord. On the inside of the spinal cord, a narrowing. So basically, you have arthritic projections coming off the spinal bones that then can push on the nerve. So this is a physical entity, a bone, that's pushing on the inside of the spinal canal on the nerve. So if you have that situation going on in the neck and the cervical spine, you can get numbness, burning, tingling in your wrist, in your hands, and your fingers. You could lose grip strength. If you have it going on in the lumbar spine supplies and the sacral supplies all of the nerves to the legs and feet. So you can get symptoms such as numbness, tingling, burning that affects the feet and the legs. The symptoms are down in the feet, but the source is coming from the lower back. So that's why I have to be a detective when I'm seeing a patient trying to figure out the diagnosis. So I'm going to try to look for certain clues, look for certain uh, things that the patient tells me, and it can still be tough. One of the things that can differentiate spinal stenosis from poor circulation is if you're walking and then you're getting pain in your legs and feet when you start to walk. And one little clinical pearl that I try to do is if it only takes about a minute and you don't have to sit down and then you can keep walking again, a lot of times that's going to be on the circulation side as the cause. Whereas if it takes longer than a minute to recover and you have to sit down, a lot of times that's coming from the back. And so that's going to be coming from the back as the cause, and that's going to be a neurologic cause rather than a circulation cause to the pain. So a lot of times what can happen, you can get numbness, tingling, and burning. Those things usually do not have a lifestyle effect. They're not going to really impact your lifestyle, although it can be annoying. But it does give you a sign that something's starting to happen, and you should try to ascertain where is the source. So that is anything that gives a symptom like that, tingling, numbness, burning, whether it's your hands and your feet, it can be coming from spinal stenosis originating from the back. It can also be coming from tarsal tunnel syndrome in the foot, in the ankle, which leads to the same symptoms in the foot, which is a similar to carpal tunnel that happens in the wrist. You can get tarsal tunnel in the foot, where the ligament pushes on the nerve, causing symptoms. Then you can also get a neuroma, which is a pinched nerve, which can also cause numbness, burning, and pain in a lot of times in the forefoot. But you can also get a lot of foot pain that's neurologic based, that's not coming from the foot or the ankle, it's coming from the lower back. And a lot of times that's what I see. So you can it can progress from numbness, burning, and tingling to an actual severe burning pain that's unrelenting, that affects your sleep. That is definitely something that warrants going to see a doctor as soon as possible. So you might have to go to a podiatrist to get that initial diagnosis. If I think that it's coming from the back and might be spinal stenosis or herniated disc, obviously I'm going to make a referral to a pain management doctor. I might refer to an orthopedist. You're going to need to get that site of where it's coming from ascertained, so then it can be treated. So a chiropractor can potentially help the situation non-surgically by moving the spinal cord alignment such that the bone is not pushing on the nerve anymore. Physical therapy can sometimes be of help, where you're increasing the strength of the muscles and you're doing stretching and strengthening of the muscles around the back to try to help the problem. You can get, of course, there are prescriptions that can be taken to help with the symptoms. So if the pain is unrelenting and it's affecting your sleep, well, I have no problem recommending a prescription to help with the symptoms. One of the ones that can be used is called gabapentin or Neurontin or Lyrica or Cymbalta. Realize, though, that that can help the symptoms, but it's not getting to the root of the problem. So you do want to still identify the root of the problem, hopefully address that, and then at that time, gradually wean yourself off the prescription, which is basically helping the symptom, but not getting to the root of the problem. So as long as that is being addressed, I have no problem taking a medical prescription for that problem. If it's a numbness or a tingling, you don't necessarily need to get that kind of prescription because it's not affecting your sleep. If it's just a little bit of a nuisance, then you don't necessarily have to go on the gabapentin Neurontin, which by itself can help the symptoms, but it also does come with side effects where it can make you a little sleepy. It can make you a little bit uh, out of it mentally. It can possibly increase your chances of falling. It can increase chances of swelling in your legs. So, although it helps the pain, it does come with side effects. Although, if it's the pain is bad and it's affecting your sleep, then I am all for doing everything in your power to help get a good sleep where your body repairs itself. And whether it's if it's a prescription that's needed, so be it. I will also go along with that, putting that medical band-aid on of the prescription. I will then try to do some natural things to try to improve the nerve function. Well, what's one thing that I use is recommending hemp seed oil. So your body has an endocannabinoid system already in the body, and the cannabinoids are do have uh, attachments in the peripheral system in regards to nerve function, and hemp seed oil can help improve the nerve function, which can then help reduce symptoms. A step further than that would be CBD taken orally or topically. That can be something that can help also. In states that have medical marijuana, that would be the next step, where you're taking even further, where you have to get a prescription for it from a doctor, and you can take medical marijuana to help you sleep. It can help with the symptoms of your nerve pain. It could help you sleep, and that's all important too. Some other things that I like to use are bioavailable vitamin B1 to make new nerve cells. B1 is called thiamine. Bioavailable B1 is called benfotiamine. So even if you're on gabapentin for the symptom, I would personally recommend to the patient to start taking some vitamin B1. Or if we get a blood test done and see that vitamin B12 is deficient, well, then that can be given also. Oral vitamin B12 in a sublingual lozenge with methylcobalamin as the form, which is the bioavailable form of B12, which is cyanocobalamin. It has to convert to methylcobalamin. So you might as well get the methylcobalamin. You might as well put it under your tongue and use it as a lozenge so it bypasses the stomach acid, which if you take B12 as a pill, it gets to your stomach and it gets destroyed by the acid. So you want to take that sublingually, which then acts as an intravenous because it bypasses the stomach and it gets into your system through the sublingual system. So that's something that can help with nerve symptoms such as numbness, tingling, burning. CoQ10 is something that can be used if potentially the patient's on a cholesterol lowering medicine and their CoQ10 goes down. You can supplement with ubiquinol CoQ10 and you can help the symptoms of nerve pain from if that is the cause by taking a bioavailable CoQ10. There's such a thing called alpha lipoic acid that's an antioxidant, and that's something that can be given that could potentially help the symptoms. Even if the symptoms are spinal stenosis and coming from the back, you can help the nerve function by taking some alpha lipoic acid, by taking CoQ10, by taking B1 bioavailable, by taking B12. These are things that can help the nerve function better. But you do have to realize that if it's coming from the lower back, then that needs to be addressed first and foremost because that is the source. Some other things that can be done for spinal stenosis if it is not responding to the medicines, Before going to a surgery, there's such a thing as a spinal cord implant where they implant it. It's a ambulatory outpatient surgery where an implant, just like a pacemaker, is put into the spine in the area of the spine that's affected, and it sort of blocks the pain message from going out. So then your brain is not getting the pain signal, and then you can live a life with less pain. And so that's going to help your life, obviously, your daily living activities and your sleep too. Obviously, surgery is potentially something that can be done also, but that is not to be taken lightly. To do a spinal stenosis surgery requires getting into the spine, which is invasive, taking away the bone that causes the impingement on the nerve, and no guarantee that it's going to work, and no guarantee that the same process might happen again. So that would be of last resort. There's also an up and coming regimen of stem cell treatments that are being used for all conditions. And that is something that's very exciting that might be able to be used successfully for spinal stenosis, which would be a non surgical way to treat it. That is in the process. It's being done right now by functional medicine doctors. It's not in the mainstream yet. Ultimately, it will be in the mainstream, and that would be obviously a better thing to do prior to doing a surgery is you do a stem cell treatment. Realize if you do get that treatment, it might take a year for it to work. So that's not going to be an overnight result. It's going to take a while. From my end, the treatment that I can provide is giving the right foundation under the foot. So the foot has a direct link to the lower back. So if you are having a spinal stenosis issue in the lumbar spine, then obviously the right foundation under the foot is going to have a direct impl- uh, a direct impact on that. So I have found that anybody with nerve symptoms on the foot are going to require a very soft orthotic. They have what's called a sensitive foot. I actually designed an orthotic called the sensitive foot orthotic. That's for people that have nerve symptoms, whether it's coming from the lower back, like spinal stenosis, or a herniated disc, or it could be coming from diabetes related neuropathy. It could be coming from fibromyalgia, chronic regional pain syndrome. All of these can give very sensitive feet. So even if you have a flat foot that requires motion control, I still have determined that you have to put a very, very soft orthotic under the foot for the patient to tolerate the orthotic. And then from there, you put your prescription into it to try to reduce motion. If you try to put that same patient into a firm orthotic with the same prescription, they will not be able to tolerate that firm orthotic because they have a sensitive foot. So what good is an orthotic if the patient can't wear it? So that's why I go as soft as possible with an orthotic in somebody that has nerve symptoms in their foot. I'm going to go right to the softest orthotic that I can provide with the right prescription. And hopefully that will give the right foundation, which can then help prevent this disease process from progressing. So, for instance, if you have a flat foot, if you control the motion with an orthotic that can be tolerated, you're going to then promote less motion going all the way to the back. Conversely, if you have the opposite of a flat foot, what I call a hard foot, that soft orthotic is the right foundation. If that hard foot needs some cushioning under it, well, obviously a soft orthotic is going to have that. But you also want to throw in the motion control also, which is what an orthotic provides. It provides a prescription to the back, middle, and front of the foot, which an over-the-counter arch support or an over-the-counter orthotic, if that's what they're calling it, is not going to provide. So you not only want the right material under your foot, but you want the right prescription in there to control motion to all the areas of the foot. And then you have a chance to prevent things from getting worse and to try to maintain and hopefully to get things better with some various other treatments that are being done, whether it's prescription, supplementation, spinal cord implant, stem cell treatments, chiropractic treatments, physical therapy. Throw everything that you need to at it, short of surgery, because in my experience, I find that people that get back surgery don't usually have one surgery. They usually have more than one. So you don't want to have back surgery to begin that slippery slope of having 2 or 3 back surgeries. Because, of course, there are significant risks of doing back surgery, including potential paralyzing the legs. And it's just something, and even from the anesthesia, you can get a lot of side effects on the body just from the effect that anesthesia has on your body. So at all costs, try to avoid surgery. Sometimes that has to be done, but there are many, many things that can be done prior to getting to that point. One of the best ways to diagnose spinal stenosis, by the way, is going to be an x-ray is going to be the first thing that the doctor will do. That will show spinal stenosis, but if it doesn't show the significant findings, then the next thing is going to be a CAT scan or an MRI. An MRI is going to be very, very specific as to finding stenosis. Mind you, if the report says spinal stenosis and it doesn't necessarily mean that it's clinically significant, because MRIs are going to show a large amount of specificity. It doesn't necessarily mean that it's playing a clinical role. So that's where the doctor has to use their judgment and to see if they think that the spinal stenosis is actually causing it or not. So it may cause it, it may not. It may not be pushing on the nerve enough or not at all. So there are varying degrees. That's why the practice of medicine is an art and a science. There are when you're dealing with spinal stenosis, it can be a very hard thing to diagnose. It can be a very, very hard thing to treat. And worst comes to worst, you might not be able to get a full resolution of that problem, but at the very least, you can make yourself more comfortable doing many, many things uh, naturally, prescription wise, treatment wise. And then from my end, of course, get the right foundation with a very, very soft orthotic. And then hopefully that will allow you to at least have a better lifestyle in regards to getting around in your daily living activities, and hopefully it will not impact you so much to the point that you're not able to do the things that you want to do. Well, it looks like we are out of here for today. I hope you enjoyed the show and learned something new. I want to thank all of my Striders for your support. I hope that you guys can incorporate today's topic into your lifestyle gradually over the next month to then make it a habit. Email me at docrick@startwithyourfeet.com if you have any particular topics you would like me to talk about on future shows. Until next time, start thinking outside the box in your approach to overall health by looking to your feet as a starting point. Walk strong and live long, my friends. See you next time on Holistic Strides.